You know, approximately 3.4 million people in the U.S. alone are homeless, many of whom suffer from chronic medical conditions like diabetes, high blood pressure, and heart disease. But with little access to regular health care, they're often treated in hospital emergency rooms for these conditions. New research looks at how collaboration between hospitals and community agencies may help to change that. Haley Weldon has more in this week's report from the Journal of the American Medical Association.
When Sam was homeless, he often went to the emergency room for treatment of his liver problems and arthritis.
Homeless individuals tend to have poor access to health care, and they use the health care system usually very late and require emergency room care and all too often admission to the hospital.
While in the ER several years ago, Sam was asked about his living conditions.
I said I only had my truck, that was it. And I was standing in that.
He ended up being one of about 400 homeless people recruited from the ER to participate in research being led by Drs. Laura Sadowski and Romina Key of Stroger Hospital of Cook County, Illinois. Selected to participate in a new assistance program, Sam had regular meetings with a case manager and got help obtaining temporary, then permanent housing.
They just asked questions that am I having this kind of a problem, or am I having that kind of a problem? How do you like it over at the apartment?
After adjusting for factors like age, race, and gender, the study showed that those in the intervention group had a relative reduction of 29% in hospitalizations and 24% in emergency department visits compared to those who did not receive any extra assistance. The research is featured this week in JAMA, the Journal of the American Medical Association.
Homelessness is common in our society. Homelessness is a burden not only on the individual but also on the communities in which individuals live. And this kind of research can show that we can impact the health care for the homeless with chronic medical illnesses in a positive way for both the individual and for the communities in which they live.
For Sam, the added support resulted in his own apartment and the stability to better manage his medical conditions and stay out of the hospital.
Life is getting better. It's always getting better.
Haley Weldon, The JAMA Report.